Yeah, for the next nerve issue we should be discussing this evening is the carpal tunnel syndrome. Carpal tunnel syndrome. So for the carpal tunnel syndrome, of course you know that it's an issue, okay, with the nerve. Now, which nerve? It's just simple, the median nerve. Now, median nerve is all over the arm, but there's a region of the arm or region of the hand, okay, where the median nerve is likely to get injured. Now, this is the wrist, right? So you could have issues where the median nerve is compressed at the wrist, okay. That's what we call the carpal tunnel syndrome. So let's discuss it further. It's just a common condition. It's caused by what? Compression of the median nerve. So the median nerve is passing through the carpal tunnel. All right. As it's passing through the carpal tunnel, there's a compression of it. All right. So it's a narrow passageway in your wrist. Now, this nerve controls sensation and movement in parts of your hand, especially this part that is what? Labeled blue. So for the part labeled blue, if the median nerve is affected, the part is affected because the nerve supply is kind of like cut off, okay, or distorted. So key symptoms is tingling or numbness in your fingers, especially the side of the median nerve. That's the thumb, the index, the middle finger. All right. So there's pain in your wrist or hand. See the red area. Weak gripping. If you want to hold things, is weak. Symptoms often worsen at night or when you try to use your hand for a long time. Alright, so causes and risk factors. Repetitive hand movement. So maybe I've doing things like typing, using some tools for a very long time. Wrist injuries or fractures. Pregnancies. So in pregnancy sometimes, you have a lot of fluid accumulation, you understand. There are medical conditions like diabetes, hypothyroidism, rheumatoid arthritis. Then genetic predisposition. So some people, normally this place where the median nerve is supposed to pass is very small. Do you understand? That was just how they were born. This is a very good image which you can pause to observe. So diagnosis, physical examination, so Tinel signs, Phalen's maneuver, nerve conduction studies, imagings like ultrasound, MRI. All of this can actually be used on certain cases. So treatments is wrist splints. They could just give you something that will help to keep your wrist in one place so that it can recover. Activity modification. Avoid any activities that will stress the wrist. Okay. Then inflammation is setting in. You take non-steroidal anti-inflammatory drugs. Okay. Then hand exercises just to improve your recovery. So treatments is steroid injections. Then surgeries. Okay. If the ligaments are tightening over the nerve too much, you have to actually do a surgery just to release the nerve from the tightening. Okay, so that's it for carpal tunnel syndrome.